10 years post-op, I have uneven eyes. Any suggestions? I'm 52 years old, Asian. I had upper eyelid surgery more than 10 years ago. I did not like the result of the right eye because the right inner corner is folding differently. It makes two eyes uneven. The doctor told me it is Asian epicanthal fold and cannot be changed. Is it possible to correct it? Is it possible to make the right eye inner corner more like the left eye?
Thank you for your question. You're 52 years old and you state that you had Asian eyelid surgery done about 10 years ago and you were never happy with the result of your right eye compared to your left eye. You inquired with your physician about this and you had an explanation that had to do with the epicanthal fold, and you're asking, is there something you can do at this point in time? Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon, and Asian eyelid surgery has been a focus in my practice for over 20 years. And it is certainly something I have a lot of experience with, and I can give you some guidance as to your situation. So, to begin with, it's very important to have a definition of the terminology that's being used. So let's start with the term epicanthal fold. The word epicanthal, epi over and canthus, corner, means that what is being described is the fold of skin that goes over the inner corner of the eye. Now that epicanthal fold can be very minimal. It can be just starting at the top and then fading away, or it can actually be equal on the top to the bottom, and then in rare cases it actually could be reversed or narrow in the top and wide in the bottom. So there are different types of epicanthal folds. When you look at your upper eyelid crease, the right side, the parallel part, goes past the epicanthal fold. In other words, it's going across the upper eyelid, and it just fades inward and leaves you with a wider margin between or space between the margin and the eyelid crease. On the left side, it looks like the eyelid crease flows into the epicanthal fold, which means that the space between the margin and the crease is actually narrower. From my perspective, I tend to favor the natural crease where it follows and flows into the epicanthal fold as it does in your left eye. But the challenge here is that you probably don't have enough skin to try to create that same result as you have on the left side. When people come to our practice, a lot of times they actually like the look of the right eye that you have and one in the left eye. When people come for consultation who have had no surgery, then this is where the opportunity is to really customize it to the patient's desire. A lot of times the fixation of the crease and this is a technical statement, but when you move that fixation away from the epicanthal fold, it tends to flow inward towards the epicanthal fold, and as you move it more towards the nose, you can create more of a parallel crease. But that also depends a lot on factors such as fat, the skin tone, the amount of skin, and with a lot of situations where we do non-incisional Asian eyelid surgery, which is where we're not removing skin, but rather anchoring skin strategically, then creating this type of nasally tapered crease is really very, very straightforward, because you can actually not take away skin and leave out one more variable, and by anchoring the skin in a sweet spot in an area of the upper eyelid, you're able to create that fold. So it's still all about customization. Bottom line with you is that if you don't want the left eye to look like the right eye, which obviously you don't, I think that additional surgery is not likely to be to benefit you because you just probably don't have enough skin. Now, technically, could there be release of scar tissue and release and try to get the skin to fold? Yes, but that tends not to be that predictable. So I would probably dissuade you from doing any kind of procedure. Now, of course, this is in the absence of a physical exam. So you may want to just get additional opinions and see what the feasibility is to try to get the other side to look, the left side, the right side to look more like the left. But I still think that it is not likely to be as predictable as you would like. So I hope that was helpful. I wish you the best of luck. Thank you for your question.